Hello, my name is Rachel McLay-Barnes and I'm a Neurology Nurse Specialist based at Dunedin Hospital, and I cover the Otago and Southern region in this role. I have worked with people with MS since the early 2000s when disease-modifying therapies became available in New Zealand. A large component of my role is working with people that have been recently diagnosed with MS and those that are commencing or considering a disease-modifying therapy for the treatment of MS. In 2019, I was awarded a scholarship to attend an international MS conference the following year. This was sadly postponed due to the COVID-19 pandemic. Finally, in October of 2023, I headed to Milan, Italy, to the ECTRIMS and ECTRIMS meeting, and you see on the screen there what those acronyms stand for. This presentation is about my experience and impressions on attending the conference. I will also touch on a couple of the presentations that I hope may be of interest to listeners. You'll see that there are a huge number of participants from all around the world. It was extraordinary. When deciding on what conference to attend, it was important to me that a nursing element, inclusive of dedicated nursing sessions within the program, along with sessions that would add to my knowledge and would in turn benefit the group that I am involved with. So this slide captures an overview of the sessions I attended. I spent a fair bit of time planning in advance the sessions I would aim to attend. Many of our people with MS, as we know, are female. Sessions particular to female health, including pregnancy, breastfeeding, along with menopause, were ones that I made a point of attending. I will talk a little bit about the menopause debate a bit more in the next slide. Updates on long-term safety of disease-modifying therapies is always valuable and is reassuring. This is something that those on a particular therapy are keen to hear about. The fascinating area of prodromic MS and trying to tease out ways of identifying early red flags and reducing the risk of MS conversion will be something that may be incredible in the future. I visited the Brain Health booth, and I understand that they hope to release an update to their 2015 report, and hopefully that's in the pipeline. So I was really keen to attend this debate, the burning debate, all women with MS should start hormone replacement therapy unless contraindicated. Menopause, along with hormone replacement therapy in general, has been a hot topic in recent times, so this was really timely. It was also pleasing to see the number of people that attended the session. You will see that the audience was asked to vote at the beginning of the debate, and we then voted at the end to pay attention to those percentages there. So the argument put forward for the motion pointed out what hormones do and are considered neuroprotective. In menopause, these drop abruptly for women, resulting in what is often referred to as brain fog. Specific brain changes are seen on MRI scans. Evidence suggests that menopause worsens MS symptoms. Studies in mice have shown remyelination occurs with hormone replacement therapy. The important points I took from this was the timing of using HRT is important, along with the correct type of estrogen drug used, and certainly further research with specific trial design would be hugely beneficial. So the argument against using hormone replacement therapy, it was pointed out that some studies have shown there is a correlation between relapse rates dropping off at around the same age as menopause occurring. Would adding an HRT change the MS disease course? HRT comes with risk, and these are well documented, and I will not go through these today. The speaker pointed out that menopausal symptoms are harmless and will pass. Both speakers, though, agreed that if menopausal symptoms are intolerable, then HRT should be considered. You'll see at the end that the audience vote did not alter a great deal. So I've thought about this quite a bit since attending the debate, and my view is that this is something that women should discuss with their GP, particularly if menopausal symptoms are hard to tolerate, that having MS is secondary initially in this conversation. I also went to an evening session about Shift MS. I had not heard of this network before and mention it here for those that may wish to explore what the group has to offer. This was a panel discussion of people with MS, and one neurologist was on the panel. The panel discussed issues that were important to them, including how to make the most of your appointments with your neurologist. They also talked about how they have interacted with the network from a personal perspective. So finally, this slide captures my takeaway messages. The global nursing shortage will impact us all and is of huge concern. Trends towards using MS, trends towards treating MS earlier. This is something that we are now thankfully doing in New Zealand. Also using higher efficacy or treatments through pregnancy has emerged, and encouraging people to share their information about pregnancy via registries if available, I think is something that we as MS nurses should try hard to do. There will be changes in the future of how certain treatments are administered, which will be easier for individuals, but also will, I would hope, increase the ability for people that live rurally to take up some of these treatments. There is much work to do around the challenges of silent progression. My grateful thanks to the Roche MS Education Scholarship for New Zealand nurses, and to the New Zealand MS Research Trust for supporting me to attend this conference. It has been without doubt an educational and professional highlight of my career. I was overwhelmed at the number of people attending, and people attended from all corners of the world. And after all, knowledge brings hope. Thank you for listening.